Hello, welcome to this segment of Recovery TV. Today we're going to talk to you about what you can expect when you begin couples therapy. So stay with us.
Thanks for joining us today. We're going to talk about couples therapy today because it's a very common question that we get in our office. A lot of times people are calling our front office and saying we need to schedule a couples therapy appointment, and then they follow that up with what can we expect. And so Josh and I today have put together just 4 bullet points to kind of prepare and introduce you to couples therapy and what you can expect.
We do think it's important to note that couples therapy is different based upon the context of what the couple is going through.
Right.
And one of the common situations that we see couples in here in our practice is when they're dealing with infidelity or sexual addiction, and things are a little bit different there. So if you're watching this video and that's what you have experienced in your relationship, we would encourage you to watch a couple of other videos that we've done that will help you understand the process a little bit better.
Right, those other videos can give you a little bit more detail and specifics about how couples therapy will fit your specific presenting concerns.
Right. And I put a link to those videos in the cards. One's called The 5 Signs You're Not Ready for Couples Therapy After an Affair. And another one is a lengthier video that Carrie and I did called Making Sense of Infidelity.
Right.
And there are several others, and so continue to do your research, but I think it would be really important for you to watch those videos first.
One of the first things that couples comment to us as therapists when they enter couples therapy for the first time is that it feels like the first time. What this means is that they may have been doing individual therapy, they may have done group therapy, they may have done some coaching,
right.
All different kinds of mental health and relationship services, but couples therapy kind of feels like you're starting over.
Right, and the reason for that is the couple relationship is its own entity. And so a lot of people that have found themselves in couples therapy, they've already been doing the work in some other way.
Right.
And so like Carrie mentioned, individual therapy, and so it's a little shell-shocking sometimes to walk in and they feel all the nervousness and the angst that they felt the very first time that they had done therapy on their own. The second expectation that we want to point out might seem a little obvious to you, and that is to expect to tell your story.
And what that means is in the therapy room, there's going to be a your story, a my story, and our relationship story. And so those 3 stories are going to evoke feelings in you that make you very vulnerable in the room.
Right, and so the expectation really is an increased vulnerability because this isn't like individual therapy. Now you have someone else in the room, someone that's very close to you, and probably someone that has contributed to your pain, and you're telling your story with that person present. It's a very vulnerable position to be in.
And the intensity and the vulnerability is what makes couples therapy unique and valuable. And so we want you to be prepared for this because it's what actually can be the difference that makes the difference. And our third point piggybacks off our second. Because of that vulnerability that you've experienced in sharing your stories, you're going to experience that your relationship may feel sensitive to the touch.
You may have heard the expression that goes, things often get worse before they get better. Well, the same is true in the therapy process as well. We often say it, though, as progress often looks like destruction in the beginning because the process of therapy is tearing down the old so that you can rebuild the new. And so when Carrie says that things are going to be a little more sensitive to the touch, that's what she's reflecting on, is that the Band-Aids that you've put on these wounds, we're going to peel those off and not let you put Band-Aids back on that. And so those wounds are exposed and we're applying the right kind of medication, and so it's just a little more sensitive to the touch. And so you might find your relationship feeling that rawness more often.
People say to us, I didn't know this was that bad, or I didn't know that he or I really felt that way. And those are statements that help us understand that that's what's happening. You're becoming a little more sensitive. You're deconstructing everything to make room for construction, and it is painful. But a skilled therapist knows that and is going to know how to guide you through that in a way that is painful enough without being too painful.
Let me give you a side note here. If you are leaving the therapist's office and feeling really raw, and you're starting to see increased vulnerability in your relationship at home, and maybe there's a little bit more fighting or a little bit more arguing, things like that, then you're experiencing therapy happening. And so if a lot of couples will say, Josh, what are you doing to us?
Right.
You know, or they'll want to drop out of therapy at that point. And what I tell them, like, if you don't want to come back to therapy because I'm terrible at what I do, then please don't come back. I'll actually help you find someone that's better. But if you don't want to come back because it's hard, and you come in one mood and you leave in another mood, and then there's a little bit more disruption at home, that's therapy taking place, because we're not letting you bury those problems, not letting you bury your head in the sand. And so that's just the beginning phases. It does get better along the way.
Right. And that brings us to our final point, which is couples therapy is going to take some time, but it won't take forever.
Right, and I think that last piece that you said, Carrie, is really important for couples to know, is that it doesn't take forever. It often takes years and years and years to get to the point where a couple needs to come to therapy. And I don't necessarily mean years in the couple relationship. I'm talking about the things that started all the way back when you were a kid, and you build and build and build those things, and you bring those into the couple relationship, and you continue to build. But it doesn't take that long to address those and heal from those wounds, mend those wounds, and mend the couple relationship.
And the other good thing about couples therapy is that it's very effective in helping clients with all kinds of issues. Mental health issues like depression, anxiety, relationship issues like conflict, sexual problems, and it's a very important factor in success in treating a wide range of addictions. And so to know that something's going to be hard, will take a while, but not forever, but has the potential to address so many important things, we want you to really hear the message that it is worth the time.
If you were to come see us, it would be very unusual for us to not recommend couples therapy at some point in your treatment. So we are very much advocates for that component of the therapy.
Right. And you have to remember that once you enter into a committed relationship with somebody, that relationship is its own entity. It has its own life force, so to speak. And so it needs attention, and it needs to be nurtured. It needs to have the space to grow, and grow in a healthy way. And so part of mental health is relationship health. Thanks for joining us, and we hope that you found these tips helpful, that they'll give you an idea of what to expect, and maybe even encourage you to take that brave step and reach out and initiate couples therapy.
As you take that next step in bettering your life and in your couple relationship, we would encourage you to look for a therapist that knows how to work with couples and also the particular issue that you're going through. And so I've put a link in the description of this video below to some therapist directories that'll help you search for therapists in your area, and make sure you read about them, look them up, search their websites, even call them and interview them a little bit to make sure that they're equipped and they have the proper training to work with you. You deserve it.
Thanks for watching.
Thanks. Hello, welcome to this segment of Recovery TV. Today we're going to talk to you, I've already forgot, couples therapy. What to expect in couples therapy.
Yeah. So today we're going to start with bullet point number 1 about what to expect. I don't like that. So our first bullet point today for your... Once I say fur, it's all over.
This next point we want to highlight might seem a little obvious, and that is expect to tell your story. And so most people will... sorry.
It's all right.
The second point we want to point out... The second point on what to expect might seem a little obvious to you, and that is...
We're both stumbling over words.
Oh, man. All right.
Got our
tongue.
Okay.
This isn't like individual therapy where it's just you and your therapist having this conversation and you telling your story to your therapist.
Just go back to saying, telling
and you telling your story. Okay. I think, were you looking at me or?
Oh, sorry.
Thanks for being with us today.
Okay.
let's close it out.
Okay.
You close it out. You go.
Okay, just love you.
Just say, yeah. Thanks for watching.
Thanks for watching.
Thanks.